When a referral is made from the GP practice, we do it through an integrated online platform. And so what we do is we are monitoring that pretty much on the hour, and then we would identify when someone's been sent down and we get in touch with them. From the GP practice, I think they normally do tell patients to get in touch, but we like to be proactive, get in touch with them so they're seen quicker. Most community pharmacies now will be equipped with a consultation room, which will have all equipment in there, which includes like an otoscope, pulse oximeter, thermometer, all of the things that we need to check for vitals. That's why we allow longer, like 20 minutes, to actually do a consultation. So it's like taking medical history, medications taken, past medical history, and we'll note all of those things down. If there's certain things like vitals that we've checked as well, we need to document all of that. And then it's just the general consultation, so anything that has been discussed during that consultation, the symptoms, how long duration, everything you would see from a classic consultation will be captured on there, alongside with if we did take any action, including medicines given, we make sure we document that properly and fully, so then that can all be transferred over to the GP practice so they can see exactly what's happened with their patient. We're using a digital platform, which would be like a pro forma template, which would follow. And so firstly, we're making sure that we're happy with their consent, so the patient's happy with consent for their data to be shared with their GP and also with the NHS. And then we're looking at just medical history as well, and assessment, so checking things like their past medical history, current medical history, and any medicines that they're taking, including any drug allergies as well. We want to capture the people that are high risk, or if there's any red flags. So we do try to find those quite early on so they can be referred to the right place. But most of the time when people are coming to us, it's quite a straightforward consultation that we're going to be conducting. So we'll capture all of the clinical notes, which includes what the presenting symptoms are and any notes that we have in terms of what we might be offering. And sometimes that will be including medication, which is prescription only, which we would do in accordance to a PGD. So it's not all the time, but it gives us that option, which can be really useful, so we don't have to refer back to the GP, adding another appointment. And so this information then is all collated together on this form, and we would submit it via NHS Mail, or some other pharmacies might use an NHS assured digital platform. And after all of the consultations done, we'll make sure that there is safety netting. So whatever the outcome is, even if the patient is seeming okay, they can make sure that they know they can come back to us, or if they need to go to a different healthcare provider, they'll know where to go and when to go. And if there is something that's a bit more urgent, we won't rely on this platform to just send the information. We'll actually pick up the phone. So whether it's to pick up the phone to the GP, it could be to A&E, it could be out of hours as well that we do deal with. So where we have walk-in patients that come into the pharmacy with minor ailments, we like to get the whole team involved. So quite often we'll have a counter team that are talking to the patients, and they might mention one of the 7 conditions, which includes like shingles, sinusitis, sore throat, those sort of things. And where that happens, the counter staff will get the pharmacist involved, and we'll go through some of the questions. So normally this is done at the counter. And what we're trying to do is we're trying to establish whether the person meets what's called the gateway criteria. And that's normally at a stage with a minor illness where prescription medication might be considered. And what we would do, if that is the case, we would again go into the room, consultation room, sit down, have an in-depth pharmacy first consultation, which will include full record keeping and full clinical governance, making sure it's safe for the patient. Now, if it isn't the case and they don't meet the gateway criteria, it will just be classic pharmacy. So where we would be offering advice over the counter, and if applicable, we would offer an over-the-counter medication. So Pharmacy First has probably been the best service in terms of collaboration between GPs and community pharmacies. Through the GP practices doing the referrals to community pharmacies, it allows the right people to be seen by the GPs in a timely manner. And it means that people that can be seen in a community pharmacy are also seen in a timely manner.